How do you feel about nascent iodine?
I think nascent iodine is a good product, but it's microgram doses of iodine, and it won't give you the detoxification effect that we need in our toxic world we live in. So iodine in the periodic table is in the family of halides, group 17. The halides include, in the order and the size of the halides that they are, fluoride, chloride, bromide, and iodine. So each of these halides can competitively inhibit one another. So too much fluoride can cause iodine to leave. Too much bromide can cause iodine to leave. Conversely, too much iodine, we have iodine receptors. We don't have fluoride and bromide receptors, but larger amounts of iodine can cause the body to release fluoride and bromide, which we don't need. So out of those four halides, two are toxic. That's bromide and fluoride. They're toxic items. There's no known therapeutic value in the human body. We are inundated with these items. Fluoride is in our water supply. It's in a lot of medications, including a lot of antidepressant medications. It's in asthma medications. Bromide is in some medications as well. Bromide is a fire retardant. It's in computers and iPhones, and it's in blankets and curtains and bedding, and it's used as a drink, a brominated vegetable oil, and some soft drinks. So we are over-brominated, over-fluoridated, under-iodinated. This is why we're so iodine deficient. This is why we're seeing 1 in 7 women with breast cancer. And the main reason, I think there's other reasons for it, but this is the main, either the main reason or one of the main reasons. 1 in 7 women have breast cancer. 1 in 3 men have prostate cancer. Epidemic increases of pancreatic, ovarian, uterine cancer. Thyroid cancer is the fastest growing cancer. I'm totally in the weeds right now for where I was going with your question.
Nascent iodine. Let's come back to
iodine.
that. It sounds like it's okay, but it's just not as potent.
So nascent iodine. So part of the benefit of iodine is we are over-brominated and over-fluoridated. And in the work that I did with Dr. Abraham, and there were two other people involved with this work, Charles Hakala and Jorge Fletches, and my partner, Dr. Ng, 3 other people that, we were testing people and finding that iodine was able to detoxify, particularly bromide, out of the body a lot. And that's a good thing because we're over-brominated. Nascent iodine won't do that. It's not high enough. It won't do that, period, exclamation point. That's where Lugol solution at the higher concentration is a much more effective substance for correcting iodine deficiency. The human body at saturation needs milligrams of iodine. There's 2,000 milligrams or 2 grams, I should have said grams of iodine. There's 2 grams of iodine that can bind to iodine receptors throughout the body from here down to the toes. Nascent iodine and microgram dosing will never do that.
Okay, so it sounds like with the Lugols, you're going to push out bromide, potentially fluoride. When that's happening, especially early on, if somebody is new to this and they've been building that up in their system for a lifetime, anything they need to do to help that detoxification?
So sure, when you're getting rid of these toxic elements in large amounts, people can get sick. We've seen that. It's a Herxheimer reaction. The detoxification system's overloaded. So another book I wrote was Salt Your Way to Health. And the reason I wrote that book, it's a companion book to my iodine book, because I never prescribed milligram doses of iodine for people without assessing their salt levels. And generally, most people are salt deficient and they need to take some extra salt in their diet beyond what's already in food. And there's good salt and bad salt, and they need to take good unrefined salt. So if I'm going to give somebody 25, 50 milligrams of iodine, I can assure you, living in our toxic world, these people are overloaded with fluoride and bromide. I would assume, even without testing people, just tested so many people, I've seen the same phenomenon happen over and over and over. So when the body goes to release bromide, hopefully fluoride's harder to get out of the body. You need salt. You need sodium to bind to that bromide. You need chloride to help usher it out and be a competitive inhibitor here. So remember those halides, the 4 halides, bromide and fluoride are toxic, no known therapeutic value in the human body. That's what we're inundated with. The other 2, chloride and iodine, essential items we can't live without. And we should have gram amounts of chloride and iodine in the human body. Um, and the in the old days, before my time as a doctor, bromide was used much more widely in medicine, and there was there's Broma seltzer. Um, and there used to be commercials for it. It was bromine. It's Alka Seltzer is what we have now. It's Broma seltzer. So bromine was the main component of that substance. So people could get bromine toxic from the medicines they were taking. Bromine toxicity can often appear as like they're drunk. You know, they can't walk straight, they can't think straight, and if they show up in the air and the doctor would diagnose bromine toxicity, the treatment for it was salting the bromine out. They give them salt IVs, saline IVs. And so when I give them iodine and I know they're going to release lots of bromine, I'm going to give them salt to make sure they can help that salt come out. And sometimes if I've either made a mistake or pushed somebody too hard, or maybe I forgot to tell them to take salt, um, that they call me up and they don't feel good when they start iodine. I tell them, stop the iodine. I want you to take an extra teaspoon of unrefined salt a day for 2 weeks. However you want to get it in, put it on your food or put it in the water or whatever you want to do, and then start the iodine again. And I can tell you the vast majority of people, those symptoms go away when that happens. Now, it's not just salt and iodine, vitamin C, vitamin D, vitamin A, magnesium, selenium, whatever they need as part of a holistic treatment regimen also improves the situation.
Okay, before we leave salt, I want to make sure we're really clear here. It sounds like salt is something important in general, but I've also heard of a salt flush, specifically when somebody is new to iodine. Is that something you advocate for? And if so, what does that look like?
A salt flush, look, I'm not sure what you're exactly referring to as a salt flush, but salt in the emergency room, when I used to do emergency room work, as moonlighting and stuff, you see, and I see it today, we do it in our office. You see a lot of people are hyponatremic, very low in salt levels. And it's common in old people. It's common when people get the flu. If you vomit or diarrhea, you're going to lose salt levels. And, the human body it's really designed pretty neat, where there's all these checks and balances to keep important things in this tight little range. And salt is one of them. You have all these hormones, aldosterone and renin and a couple of other ones that are designed to keep sodium in this range because we have gram amounts of sodium in our body. And the reason we have gram amounts of sodium is we can't make energy without sodium. We can't run almost any chemical reaction in the body without sodium. So your body is tightly controlled where sodium is. So when sodium drops really low, bad things can happen to people. And so you give them salts. You give them either intravenous salt or orally salt. I'm in the weeds again with where your question was with this.
Just salt flushing versus maintenance salt.
So salt flushing can be used for a lot of things. You got to be careful with salt, orally especially. If you give too much salt orally, and I've used this in patients who are severely constipated, it causes diarrhea. So I've used it therapeutically if someone's severely constipated, but I don't do salt flush without iodine and vitamin C. And I primarily use salt flushing for severe constipation, and that's all I do it for.
One of the big dietary changes that's as of more recent is the bromide in the baking. Can you talk about the history there? We went over this last time, but I think it's important we bring it up again as we're talking about these toxic halides and how this really changed everything.
Before 1970, iodine was used as a conditioner in baking products. And so one slice of bread had 150 or 200 micrograms of iodine per slice of bread. It was the RDA for iodine. And so if you ate 2 slices of bread, you're above the RDA for iodine. And I said 50 years iodine levels have been falling across the United States. It started around 1970. So what happened in 1970? 1970, for some reason, I can't really find the incident article or the government edict telling bread manufacturers to stop using iodine as a conditioner. I don't really know where it came from, but most manufacturers of bakery products began using brominated flour instead of iodinated flour as a conditioning agent. And the issue of using bromine instead of iodine in bakery products created a double whammy. Number one, it made an iodine deficiency problem that was already there much worse, because sometimes that was the only source of iodine for people was, eating bread. And number two, it put a toxic halide into a commonly eaten product, bread, cookies, cakes, muffins, whatever. And so that is where I think led to this rapid decline in iodine starting in 1970 that we're still feeling today. And bromine has not been taken out of a lot of bakery products. You got to look at the labels, and most times doesn't even tell you. But a a good a good um, you know company who's interested in the health of people will tell you they're using iodinated flour instead of brominated flour. But you got to look at the labels, and if it doesn't say it, call the company or just find one that says it.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
Over the last 50 years, iodine levels have fallen over 50%. We've tested over 8,000 people for our iodine levels, just right below 98% are iodine deficient. The vast majority are severely iodine deficient. In our toxic world, with our exposure.